Dr. Stilwell.
Yeah, thank you very much. I'd like to thank the organization and congratulate them for this event. I'm going to talk, this is a work of my student. She's presenting a master thesis on this subject, but I'm presenting it. So this is, as a practitioner, a problem that I always had, how to reduce pain while doing trimming of cows' lesions, hoof lesions. Oh, so it goes very fast. So we've seen that lameness is, of course, a sign of pain. We have acute pain, chronic pain, but also status of hyperalgesia in many of these cases. I'll just go briefly through mechanism of pain, just to remind some of you of what happens when there's a trauma, when there's a painful stimulus. There are two fibers that are active. One's A delta that will bring in the immediate pain, and then the C fibers that will bring in the dull and more diffuse pain, also called secondary pain. This is what happens when there's a trauma. But when we're talking about hoof lesions, we have a different condition. We have inflammation many times, and then we have the active, the silent fibers that will bring in other stimulus to the central nervous system, and this can lead to a status of primary and secondary hyperalgesia. So this is, we know as practitioners, we see a lot of these cows with hoof lesions, and what happens with these cows, they're in constant pain. There is what is called nowadays a wind-up that comes from the constant and permanent stimulus from the lesion, and these cows are suffering. But these cows are also very sensitive. Their foot is very sensitive, and so when we go and treat these animals and we have to trim and to put some pressure on these lesions, of course we have to think that the pain can be very, very high. This has been proven by many studies. This is one from Wei and colleagues that showed that, for example, sole ulcers will continue having pain even after treatment, will continue having an hyperalgesia status for up to 28 days. And this was done by algometry, done in the metatarsus region, so not on the lesion itself. So it shows that there is pain all around the limb, the distal limb in these animals. So lame cows with claw lesions are much more sensitive to trimming. And we know as practitioners, and everyone knows that this is true. There is a survey in Switzerland that showed that vets and trimmers and farmers grade pain in these animals quite high. They also think that anesthesia is beneficial. So it's something that we know it's true, but very few people do it. This survey was done in Switzerland, but I'm sure that in Portugal it's the same, and I'm sure that in most countries it will be the same. We know there is pain, but we don't do much about it. Why is this? Especially because it's very expensive, time-consuming, to do what would be the perfect solution. That would be if I do it when I do very painful procedures, intravenous analgesia, using local anesthetic intravenously. But this is also a small study in Ontario, and we see the same thing. Practitioners grade pain in sole ulcers has quite high or moderate to high, but they say they do very poor pain management in these animals. And this is also true in other countries. So the objective of this study was to see if we could find an efficient, a practical, cost-effective way of controlling pain that could be used by non-veterinarians like farmers or trimmers. You've seen this product. We don't have it in Europe, but I managed to get it to Europe, and I thank here Animal Ethics Australia for providing that product. I had seen this product being used in dehorning and castration, like you saw this morning, and I managed to get the product into Europe. The problem with this is that lidocaine is not licensed anymore in Europe, so I had to have a special permission to use it, and I only use it on cattle that were going to be dried off, so the milk wouldn't be used for human consumption. So what we did was we scored lameness to animals that were taken to the crate or to the chute. We diagnosed the lesion. If it was a sole ulcer, white lesion, or toe ulcer, we would include it in the study and randomly selected for one of the group, one that got the trisulfan and one that got another gel, innocuous gel. And then we did the trimming, normal, done by an experienced veterinarian, and all this was all the behaviors and the lameness was observed and registered and graded by people blind to the use of the trisulfan. We also, in the second stage of the study, we also did some algometry. You could see there the algometer being put to the site, so to measure the threshold, the pressure threshold of these animals at the lesion. So we got to 33 animals in the trisulfan group and 29 in the control group. And you can see up there the numbers of sole ulcers, toe ulcers, white line disease, or in one case, a mixed case. We measured the lesions. We registered the amount of tissue that was taken off, and we did an observation of behavior of these animals. The behavior of these animals in the chute was kicking, or withdrawing the leg, or falling down, not completely falling down, but going down on the rope that usually holds them. So two persons were observing this and registering this behavior, and they were blind to the treatment. So there were no difference between groups in the type of lesion, in the lesion dimension, and the debris removed. There were no difference in lameness scoring when they went into the chute, but there was a higher score for non-treated animals when they came out of the chute. So it suggests that some numbing of the lesion was observed. 2 animals in the control group and 3 animals in the treatment group also had a block when they came out, but we took out these animals to do the statistical analysis, and the difference were the same. So the blocks didn't have an impact on the results. So looking at the behavior when they were being trimmed, you can see that the treatment group kicks less and withdraw less the limb while being trimmed, and the ones that and they also had less episodes of falling down or almost falling down. So we had three grades of falling down to mild or severe going down on their limbs. The algometry, as you see, less animals because they were only used in the last stage of this study, and we found out. But we want to continue repeating this study because these are very few numbers. But even so, there was increase in threshold of pressure in the animals that were given a trisulfan. So there was, like I said, a numbing of that area that would allow for an increased pressure. Going now to the residues. So this looks like a very useful product to be used in dairy cattle, because we can increase the safety even of the trimmer by being there, and if the cow kicks less, you're safer. We can increase the welfare of the animal while it's there, so there's less pain. Of course, it's not not perfect like the intravenous injection, but we know that that's not practical. Farmers won't use it, trimmers won't use it, because you need a vet to do it. So this seems like a good way of doing it. We did it with the cows being dried off. The ideal would be to use it any time we had to take a cow to the chute to trim the hoofs. So we did this small study with only 5 cows. They're not the ones included in the other study, in which we took milk for 2 days after being trimmed, and we will look for residues of the products that were in trisulfan, and we found very small quantities of some of these metabolites, like 2.5 xylidine. That is now, that's the reason why lidocaine is not anymore licensed. But we found very small quantities, and only in the first or second milking after treatment. So I think in the future, perhaps this could be a good tool for trimmers to have when they're doing these painful procedures. Okay, so the takeaway message is that core lesions cause severe lameness, and in most times an hypoalgesic state. A claw trimming of common lesions will cause pain, we know that. Anesthesia during trimming is beneficial for the cow and the trimmer, because it increases its safety, his safety. Trisulfan is a spray-on sticky gel, like the procedure speaker said. It sticks to the lesion, and that is good. Reaction during trimming is reduced after application of trisulfan, and pressure thresholds on the lesion increase after the application. So it seems, like I said, it doesn't take away all pain, but it seems that it does reduce some of the pain that we cause when we do this procedure. And so, thank you very much, and I open to questions.
Thank you very much. It's time for questions.